Hello, podcast listeners. Hope you guys are having a great National Diabetes Awareness Month 2025. I have a really cool episode for you guys today, and it started last month, about October 14th, when California Governor Gavin Newsom announced that the state had produced $11 per pen insulin for Californians. Quote, "We took matters into our own hands to make our own insulin." And this was a follow up to an announcement he had made previously about a project to develop through CalRx insulin, glargine, and aspart for Californians as a state led response to the insulin crisis in the United States. This was interesting, and I dug into this a little bit. I responded to the CalRx website and looked for information to try to get a little bit more for you guys because I saw a lot of commentary in the community about, okay, long acting insulin is good. What about rapid acting or fast acting insulin? I got some answers and I was connected to Allan Couckell, who actually is from CivicaRX. So a few years ago, you may remember there was a big announcement from Breakthrough T1D about a partnership with a nonprofit insulin manufacturer called Civica. So we learned a little bit more about Civica. Allan Couckell, who is the policy director at Civica, joins us for the interview and answers some of the questions that I saw in the community. So I'm really interested to hear your response to this. And what's really cool is not only will on January 1st, insulin glargine be available via CalRx for Californians, but also through other pharmacies, patients from all over the United States will be able to order the same CivicaRx produced insulin glargine. And Allan also provides an update for us on insulin aspart. There's no timeline, but it is in development. So please enjoy this interview with Allan Couckell from CivicaRx. Hello and welcome to another episode of Diabetics Doing Things. We are telling the amazing stories of people with diabetes from all over the world. Today's episode is a little bit different. We had some amazing news. We're recording this on October 31st, 2025. And in the middle of this month, California Governor Gavin Newsom had announced the development through CalRx of long-acting insulin pens for Californians with diabetes that would be available for $11 per pen or $55 for a 5-pack starting in January 2026. So I reached out to CalRx and they were able to connect me with Civica, which if you may remember a few years ago, there were some big announcements and we're going to talk about those today in partnership with some other diabetes organizations. So I have Allan Couckell, who is from Civica here working on policy, who's here to talk a little bit about the big announcement and what people should know.
Hey, Rob. Really good to be with you.
Yeah, very exciting to have this conversation, and thank you for your time. So let's just talk a little bit about you and who you are and your background and what you do for Civica.
Yeah, unlike most of your guests, I don't have diabetes. Although, of course, like everybody, I have people in my family who have diabetes and who've depended on insulin. So, fully know how important it is. But I'm with Civica, also called CivicaRX. We're a nonprofit generic drug company. I'm actually a pharmacist by training, but with Civica, I lead our public policy work. I'm the Chief Government Affairs and Public Policy Officer.
Awesome. And so I imagine you're interfacing with lawmakers and policy folks on a regular basis. There was recently, I follow the Diabetes PAC account, and there were some folks on Capitol Hill recently. What kind of conversations do you have with, lawmakers? We'll kind of dig in a little bit more to what Governor Gavin Newsom was talking about recently, but when you're having conversations with representatives, like how do those conversations go with regard to, patients getting affordable drugs?
Yeah, I mean, drug affordability is a big deal for lawmakers in both parties. And insulin in particular has been a long-standing focus. And of course, that resulted a couple of years ago in the cap on out-of-pocket costs for insulin in Medicare, which is going to make a real difference to a lot of people, but also I think led to changes across the market in insulin pricing. But of course, an out-of-pocket cap affects the way the insurance benefit works, doesn't actually affect the underlying cost of insulin. And so at Civica, what we've embarked on doing is bringing a truly low-cost, quality, affordable insulin to market. And when I talk with policymakers, on both sides of the aisle, there's not necessarily a lot they agree on these days, but they all agree on this approach of having a, if you will, a market-based solution to address the root causes of drug pricing.
Absolutely. And diabetes doesn't discriminate between a political party, as we know.
That's right.
So let's talk a little bit about this exciting announcement from the middle of October in California via CalRx. And a little bit about it's long-acting insulin, so it's insulin glargines starting in January 2026, available for patients in California. And then we can talk about the big question, which in the diabetes community was kind of the immediate reaction was, okay, this is great for long-acting insulin. What about rapid-acting insulin? So let's just kind of start with the announcement.
Yeah, so the announcement is a really important milestone in a partnership that actually has been ongoing for a couple of years and will continue. So let me roll the clock back just a bit. Governor Newsom came into office saying California is going to make its own insulin. Right around that same time, Civica, in partnership with Breakthrough T1, a number of other funders who care a lot about diabetes and affordability, announced that we were going to make insulin as a nonprofit and that we were going to do the three insulins that account for about 80% of insulin use in the US. So biosimilar versions of Lantus, Humalog, and Novolog. And so it didn't make sense to have two efforts trying to achieve the same aim. So we were able to work with the state of California and basically say, we're going to build up the manufacturing capacity, develop these products, bring them to market. And that's an expensive undertaking. So to do all three insulins, including some capital equipment purchases that we have to make in order to make the vials and make the pens and put them together. All in, that's about a $200 million cost. And so 50 million of those dollars come from the state of California. And so the insulins in California will carry the CalRx brand. That same insulin in the rest of the country will carry the Civica brand. So we're working on those products now to be manufactured in our brand new sterile injectable drug manufacturing facility in Virginia. But in order to deliver on our promise to patients a bit quicker, in the interim, we made a partnership with a third partner company, Biocon, and they're going to manufacture insulin glargine, which, as you say, is a long-acting. And so they're going to manufacture it for Civica with the Civica label, with the CalRx label. And so that's what we're launching on January 1st as an important milestone on our journey to delivering all of those to market from our own manufacturing facility.
Yeah, thank you for outlining that. And you bring up the big question, right? And it sounds like it's a $200 million plus question, which is, once we're able to make these biosimilars, how do we make sure that we're able to continue to do so and build that capacity up as demand for these products starts to pick up? Because you can just tell by the media response, this is a big issue. Not just for Californians, but with some of the data coming out with like 1 in 2 patients making decisions to purchase insulin or pay rent and other important expenses, the rationing of insulin in America is something to continue to keep an eye on. So this is exciting. So, and I think you mentioned this a little bit in that description. This is not just for California. So Civica, there's going to be the Civica branded insulins. And I saw a couple of people making note of this in the immediate response. But how do you talk about like the patients who are outside of California who are like, wow, this is a really exciting news. I wonder when this will be available to me.
So these insulins will be available nationally at the same time. So in the case of the announcement that we've just made, insulin glargine will be available January 1st next year in California as CalRx Insulin and in the rest of the country as Civica Insulin. And it'll be available. We have 2 major wholesalers that have stepped up to carry it. So Cardinal and Syncora are those 2 wholesalers, 2 of the big 3. And so that will be something that any pharmacy in the country can order.
That's exciting. I know that people will want to know, and we'll be able to link to those and keep an eye out when those are announced at the beginning of next year. Talk a little bit about the partnership with the state of California. You mentioned that they were bringing in some of the funding, and Governor Newsom has been very vocal about California creating its own insulin for a few years now. How does that partnership with California on the state level like set up for similar engagements with other states, or even on a federal level?
Yeah, it's a really good partnership. We've been working closely with the team from the state of California for a couple of years now. We meet on a regular basis, and we have a joint steering committee. But there are other states that have also partnered. So we made an announcement this summer with Governor Glenn Youngkin of Virginia. The Commonwealth of Virginia has also put money in to support the development costs for our next insulin, which will be the fast-acting insulin. Did that looking again at the cost of insulin to residents of the Commonwealth and frankly to the state government through their employees and retirees and all of the ways that states end up paying for insulin and other drugs, and looked at that and said, let's have a different business model here where we're really bringing it to market with a focus on low cost, none of the rebates that end up raising people's out-of-pocket costs and sort of distorting the market, just one transparent low price that's available to anybody. So they're great partnerships to have, and we're still raising money to complete the development program. So there's room for other states to come in, and we'd love to have them.
And you've shared a little bit about the other two insulins, the biosimilars for Humalog and Novolog, the rapid acting insulins. What can you share about other drugs in development for even other disease states or focuses at Civica?
Yeah, so the genesis of Civica was to solve this problem that's existed in the US for more than a decade now, which is drug shortages. So people may or may not be aware, but at any given time right now, there are hundreds of drugs that are on the official drug shortage list. They tend to be old generic drugs, off patent, mostly injectable products. And for a bunch of reasons to do with the economics of generic drug manufacturing, the market's just become very fragile. Health systems got together and created Civica to say, let's have a different business model that goes at the root causes of this problem. So we've delivered about 240 million vials to hospitals around the country. We have about 1,400 hospitals around the country. So that's about enough to serve more than 90 million patients. And then, as I say, we have a brand new manufacturing facility, and we have a couple of dozen drugs in development for that facility, all kind of old generic essential products that are used in hospitals. At the same time, parallel, along with insulin, we're looking at the retail pharmacy market and saying, what are the drugs where, even though they're off patent or generic drugs, they're biosimilars, where the price to the consumer is not coming down the way it should. And there are a bunch of them now where, an average monthly claim is hundreds, even thousands of dollars, even though there's generic competitors in the market. So our first drug in this space was a prostate cancer drug. Even now, the average commercial or Medicare claim is $3,000 a month. Our maximum recommended price for the Civica script drug, that's our retail-facing entity, is $140 a month. So we have a couple of MS drugs in the market now. We have another anti-cancer drug called capecitabine, where we're driving savings of about $1,500 per prescription per month in the market. We have another one called droxidopa, which is driving $1,800 a month savings in the market. On January 1st, we'll also launch, along with insulin glargine, our first biosimilar, which will be an unbranded version of Stelara. Ustekinumab is the generic or biosimilar name. The brand version of that drug costs $25,000 for 8 weeks. There are some biosimilars that are about $3,000. Our price on that product will be less than $1,000. And so, that's the current pipeline, and we have more in the works. So our focus, with the exception of insulin, is not necessarily to start with a disease state, but to say, where's there a problem for patients that we can jump in and help to solve?
Yeah, thank you for that. I think, again, getting other parties on board too, where you're saying, hey, if the government's paying for the Medicare for these patients, or at the state level where the state is paying for it, and you're able to say, well, we can save you money here, I think it's a win-win on the policy side, which is exciting. I want to talk a little bit about the timeline. You may not be able to share it, but I want to give Civica and CalRx a lot of props here, because one thing I've noticed with big sweeping announcements and innovations like this is that it's always kind of wait and see. And there's very rarely a timeline that's able to be shared for many different reasons, most of which is that it's really hard to do. But with this announcement, it's been very consistent. And, it's like within a couple of years, this is going to be happening. I went back and looked at my notes, and yeah, it's been about 2 years since that announcement. So here we are. So I know there hasn't been anything in the release about the rapid acting biosimilars for Humalog, Novolog, and the release timing there. It's just that it's coming soon. What can you share for patients who are curious about those dates?
Yeah, and you're right. We did something unusual when we made the announcement a couple of years ago. Probably unprecedented, which is we announced our price 2 years before we had the drug. We said this will cost never more than $30 for a vial of insulin, never more than $55 for 5 pens. And here we are a couple of years later delivering, exactly at that price that we promised. But these insulin development programs are big, complicated undertakings. So we know for sure that the insulin glargine will launch on January 1st. And we have kicked off the development program of the second insulin, which will be insulin aspart. We want to be careful to manage expectations. And so we're working on it as hard as we can, as fast as we can. We haven't yet put a public timeline on it, but it's coming.
Well, it's exciting, and I know our folks in the community are going to be keeping a close eye on it. And January 1st, 2026, I imagine there's going to be quite a few orders from outside of the state of California for folks who just want to participate in this really monumentous occasion of you guys delivering, 5 pens for $55, $11 a pen for people without insurance who've been scraping together coupons or working in mutual aid or getting donations or in Facebook groups. I know this will be a huge help to thousands and thousands of people. So thank you guys for that continued work. And now on the advocacy and call to action side, like how can we help? How can the people who really care about this issue continue to support and spread the word or advocate otherwise?
Yeah, I appreciate that question. It really is a mission for us and a partnership. And we see that we're doing this for patients and we're all in it together. I mentioned that Breakthrough Type 1D is helping to fund this work, but also a number of health systems, Intermountain, Kaiser Permanente, Trinity, a whole bunch of Blue Cross Blue Shield plans, the Helmsley Trust, and others have all stepped up. Now that we have a product launching, I think the key goal is to create awareness. So people who are using that product can reach out to their health plan and ask, will this be covered? And they can check in with their pharmacy and make sure that they can get it from their pharmacy. As I said, any pharmacy can order it and dispense it, and it'll be interchangeable with the brand name product Lantus that's on the market. And also state policymakers. As I say, we're open for additional partnerships. And so if folks are talking to lawmakers, there's an opportunity here for states to step up and help make this happen.
Well, Allan, thank you for your time, for all that you and your team at CivicaRX are doing for people with diabetes and also people who are struggling with access to affordable drugs. We really appreciate it in the patient community. For more information, you guys can check out CivicaRx.org and CalRx.gov, which is where we will be able to be having access to the insulin at the beginning of next year. So, Allan, thanks again for your time and for all that you guys are doing at CivicaRx for people with diabetes like us.
Thank you, Rob. Really enjoyed talking with you.